Imagine stepping into the barn, feed bucket in hand. Your horse, usually, right there, eager to eat, just kind of gives you a sniff, maybe a little nudge, but doesn't dive in like usual. That moment, when they just stand there, maybe picking at a bit of hay, it can really set a jolt of worry through you, can't it? What seems simple, well, it often hides a lot more complexity. So today we're doing a deep dive into anorexia and decreased food intake in horses. And this isn't just about a picky eater, though it's tempting sometimes to think that. It's often a really significant signal. Could be anything from mild discomfort to a really serious, even life-threatening emergency. Our goal today is to give you the essential knowledge on why horses might suddenly go off their feed, how vets actually pinpoint the problem, and the different paths to recovery. Think of it as a vital shortcut to understanding something crucial for your horse's health. Okay, so let's unpack this a bit. When we talk about a horse not eating, it's not really a single thing, is it? There's a spectrum involved.
Absolutely. That distinction is critical. On one end, you have true anorexia. That means a complete or almost complete refusal of food. The horse just isn't getting the calories, the nutrients it needs. That's a huge red flag, a serious medical sign that needs immediate veterinary attention right away.
Okay, immediate attention, got it. And the other end.
Then there's what we call reduced food intake or hyperexia, sometimes inappetence. Here, the horse is still eating, but, significantly less than normal. This one can be more subtle. Sometimes it's less critical issues, but it definitely still needs looking into, especially if it keeps going or if you see other changes along with it. It's not just a mood.
That makes perfect sense.
Yeah.
So if a horse isn't eating, where does a vet even start? I mean, the list of possibilities seems enormous. Could be anything.
You're right, the list is long. And that's exactly why a systematic approach is key. But we can sort of group the causes into three main buckets. The first, and often the most immediate, is pain and discomfort. This is incredibly common. I mean, think about it. If it hurts to eat, you're probably not going to, right?
Yeah, makes sense.
A really common place to start looking is the mouth. Oral and dental issues are huge culprits here. We're talking sharp enamel points, cutting the cheeks or tongue, hooks, maybe a wave mouth, even missing or fractured teeth. Anything that makes chewing painful or just inefficient. And it's not always the teeth themselves. It could be sores, ulcers in the mouth, maybe from an injury, or even certain viral infections like vesicular stomatitis,
Right.
or even side effects from drugs like phenylbutazone, butate, and of course, a foreign object stuck in there would be incredibly painful too.
So it might not be obvious just looking in quickly yourself.
Exactly. A vet often needs to use sedation, a speculum, really get a good look in there. Then moving down slightly, you've got esophageal issues. Lots of people know this as choke.
Yeah.
And this is a real emergency. Food gets lodged, nothing else can go down. You'll often see the horse standing with its head low, neck stretched out, drooling.
And the feed coming out the nose.
Yes, exactly. Feed material coming out the nostrils. That's a classic sign. It needs urgent veterinary care. There are rarer things, too, like strictures or little pouches in the esophagus, but choke is the big one. Then, of course, there's gastrointestinal pain, basically any kind of bellyache. Abdominal pain can just shut down appetite instantly. This huge category includes things like colic, which itself is just a symptom, right? Abdominal pain. Could be gas, impaction, spasms, or something much worse like a twist or displacement.
Right.
And gastric ulcers, oh boy, these are incredibly common, especially in performance horses, horses under stress, or those eating a lot of grain, EGUS we call it. We also see inflammation lower down in the intestines, enteritis or colitis. Can be caused by bacteria like Salmonella, Clostridium, or diseases like Potomac horse fever often comes with diarrhea and fever too.
Wow.
And don't forget things like hindgut acidosis, maybe from too much grain, or sand colic if they're ingesting sand, all cause discomfort.
That's an incredible list just under the pain umbrella. I wouldn't have connected all those dots myself. It really shows how one symptom points in so many directions.
It really does. And just to round out the pain category, sometimes it's musculoskeletal pain. Pain in the neck or jaw obviously makes chewing hard. But a really notable one is laminitis. That severe foot pain can make a horse totally unwilling to even move to their food, let alone stand and eat. It's just profound pain affecting everything.
Okay, so we've covered a lot on pain. But what about those, bigger body-wide problems, the ones that just seem to steal our appetite completely?
Right, that leads us perfectly into the second major category, systemic illness and metabolic disturbances. Basically, diseases affecting the whole body often hammer the appetite. Infectious diseases are common culprits. Think about fevers, bacterial infections, viral ones like EHV1 or influenza, strangles, pneumonia. A fever makes us feel lousy and not want to eat. Same for horses.
Yeah, definitely.
Then there's organ dysfunction. If key organs aren't working right, it throws everything off. With kidney disease, renal failure, waste products build up in the blood, uremia, which causes nausea and sometimes even painful mouth ulcers. And liver disease is another big one. If the liver can't detoxify the blood properly, things like ammonia can build up and affect the brain. Hepatic encephalopathy causes depression and just profound lack of appetite.
So the body's internal systems are kind of going haywire.
Precisely. And then you have metabolic disorders. A classic example is hyperlipemia. You see this often in ponies, minis, donkeys, especially if they're overweight and then get stressed or suddenly have their feed restricted. Their body just starts mobilizing way too much fat, floods their system, makes them incredibly sick, depressed, and unwilling to eat.
Wow.
Another really serious one, maybe less known, is refeeding syndrome. This happens if you take a severely starved horse and refeed them too quickly. It causes dangerous electrolyte shifts, especially phosphorus dropping way too low, leads to weakness, and ironically, continued anorexia even though food is there. Needs very careful management.
That's critical to know.
Absolutely. We also have to consider toxicity. This could be from plants, like ragwort senecio species, which causes terrible liver damage, or red maple leaves causing anemia. Could also be mycotoxins in feed, heavy metals, or even adverse reactions to medications. And NSAIDs like bute or flunixin, if given at high doses or for too long, can cause nasty ulcers in the stomach or colon.
Right.
And then there are neurological conditions, things that affect the horse's actual ability to grab food or swallow. Botulism causes progressive paralysis, making swallowing hard. Facial nerve paralysis might stop them picking up food. Even EPM can sometimes present this way. And sadly, neoplasia, that's cancer. Tumors anywhere in the digestive tract or systemic cancers like lymphoma can cause severe weight loss, muscle wasting cachexia, and complete anorexia.
Goodness, that's a truly sobering list of internal issues. It really drives home that a horse off its feet. It's often not just a simple tummy ache. It's potentially the whole system signaling distress.
It absolutely is. Which brings us to our final broad category, which sometimes gets overlooked but is still important: environmental and management factors. These often cause more of a reduced intake rather than total anorexia, but they matter and can sometimes lead to bigger problems.
Like what kinds of things?
Well, in a herd, social hierarchy and competition can be a big one. A dominant horse might simply bully a more submissive one away from the feed. The lower-ranking horse might be hungry, but just too intimidated.
Yeah, I can see that.
Then there's unpalatable feed. Horses are surprisingly picky. They have a great sense of smell and taste. They'll flat out refuse spoiled hay, moldy grain, poor quality stuff. Even a sudden diet change can put them off. And don't forget water. Clean, fresh water is essential. If the water's dirty, stagnant, or tastes bad, they won't drink enough. And often, if they don't drink, they won't eat either.
I've definitely seen that. A horse refusing hay that looks fine to me, but they know something's off. They really do have discerning tastes.
They certainly do. And finally, just plain old stress. Travel, moving to a new barn, separation from buddies, being overworked, fatigue, even loneliness or depression. All these can cause temporary inappetence. Their emotional state really impacts their appetite.
So, putting this all together,
Yeah.
what does this mean for you, the listener? It sounds like if your horse isn't eating, it's really not a case of, oh, they're just being picky today. It's a serious flag.
Precisely. It's often your horse's loudest way of saying something is fundamentally wrong. And because the causes are so varied, from a simple tooth point to a complex, life-threatening illness, identifying the root cause needs a vet and a systematic approach. It's never something to just wait and see on for too long.
Okay, so you've noticed the signs your horse isn't eating right, maybe totally refusing food. What's the very first thing a vet does when they get there? How do they start tackling that huge list of possibilities?
Right, so when the vet arrives, it's like they put on their detective hat. It always starts with taking a detailed history. And it's way more than just the horse isn't eating. They'll ask you about the exact onset. When did it start? How long? How severe is it? Total refusal or just eating less? What kind of feed is being refused? Hay, grain, pasture, both. And crucially, any other signs you've seen. Any colic signs, diarrhea, fever, lameness, weight loss, lethargy, maybe drooling, nasal discharge, difficulty swallowing, changes in manure, all vital clues.
Okay.
Plus details about their routine, management, any recent medications, deworming history, travel, and definitely their dental history.
Gathering all the background intel first.
Exactly. Then comes the physical examination, a thorough nose-to-tail check. assessing their alertness, their body condition score, hydration status like skin tinting, or checking gum moisture. A really critical part is the oral exam. Often needs sedation and a speculum to get a proper look. Checking teeth for sharp points, fractures, signs of infection, looking for ulcers, foreign bodies, any swelling or pain in the mouth.
Right.
The vet will palpate the head, jaw, neck for pain or masses. Listen carefully to the abdomen with a stethoscope for gut sounds. Are they normal, increased, decreased, absent? A rectal palpation might be needed if they suspect colic or issues further back. And of course, taking the basic vitals, temperature, pulse, respiration, the TPR, plus a general assessment of pain levels.
So gathering all the external clues first before deciding what's next internally. What happens after that physical exam?
That's when we usually move to laboratory diagnostics. Blood work is incredibly valuable for looking inside. A complete blood count, a CBC, gives us info on infection or inflammation, like a high white blood cell count, which we call leukocytosis, or high fibrinogen. It also shows dehydration, like an elevated PCV, or total solids, or anemia. Then a serum biochemistry panel. This helps check organ function, liver enzymes, kidney values like BUN and creatinine. It also shows electrolyte levels, sodium, potassium, chloride, calcium, phosphorus, magnesium. These can get way out of whack with illness, dehydration, or that refeeding syndrome we mentioned. Low phosphorus is a key one there. Also checks protein levels.
So blood tests give a snapshot of the internal workings.
They really do. And depending on the case, other tests might be needed. Fecal egg counts for parasites, urinalysis, maybe specific tests for toxins or infectious diseases like EIA Coggins test or equine herpes virus. Next up is often diagnostic imaging, getting a visual look inside. Endoscopy is super useful, can use it to look in the mouth, throat, larynx, but it's especially key for gastroscopy, sticking a long camera down into the stomach. That's really the gold standard for diagnosing gastric ulcers. And esophagoscopy, to look inside the esophagus for choke damage, inflammation, or strictures.
Like sending a camera in.
Pretty much. Then there's ultrasound. Abdominal ultrasound lets us look at the intestines, check motility, fluid levels, wall thickness, and assess other organs like the liver, kidneys, spleen, look for masses or fluid, and radiographs, or x-rays. Head x-rays are great for dental issues like tooth root abscesses. Neck or chest x-rays can show bone or soft tissue problems or complications like aspiration pneumonia if they inhaled food during choke.
Wow, quite the toolkit. Sounds like sometimes it's even a process of elimination, or maybe seeing how they respond to something.
Exactly right. Sometimes we use therapeutic trials. Basically, if you suspect something, you might try a specific treatment and see if the horse improves. That response can help confirm your suspicion. For example, carefully using an NSAID if you strongly suspect pain is the primary issue, or trying omeprazole, the ulcer medication, if gastric ulcers seem very likely based on history and signs. A positive response helps point you in the right direction.
Okay, so the detective work is done. You hopefully have a diagnosis, or at least a strong suspected cause. What happens next? It can't just be about forcing them to eat, right?
No, definitely not. The approach is really two-pronged. You absolutely have to address the underlying cause. That's number one. But at the same time, you need to provide crucial supportive care, including nutritional support, to keep the horse stable and help them recover.
Right, fix the root problem.
Precisely. So if it's dental issues, that means floating the teeth, maybe extractions. If it's choke, that's an emergency procedure sedation, passing a nasogastric tube, gentle lavage to clear the blockage. Colic might need medical management with fluids and pain relief, or potentially surgery. Gastric ulcers get specific meds like omeprazole or ranitidine. Infections need the right antibiotics or antivirals. Liver or kidney disease requires very specific supportive care and tailored diets. If it was a toxin, you remove the source immediately. And if it's environmental or social, you might need to change herd dynamics, provide separate feeding, ensure the feed is appealing, guarantee clean water, and work on reducing stress.
Okay, tackling the cause head on, and the supportive care part.
That's just as vital, especially if they haven't eaten for a bit. The ideal is always to encourage voluntary intake first, get them eating on their own again. This often means offering a buffet, a smorgasbord of highly palatable options, different types of hay, maybe some nice alfalfa along with their grass hay, fresh grass if possible. Softened feeds like soaked pellets or bran mashes can be very tempting.
Make it easy and appealing.
Exactly. Small, frequent meals are often better than one big one. Warm water can sometimes encourage drinking, which helps appetite. And effective pain control is absolutely key here. If they're still in pain, they likely won't eat no matter how nice the food is. Now, people sometimes ask about appetite stimulants, things like probiotics, B vitamins, maybe adding molasses. These might help improve palatability a little, make the food more interesting.
But they aren't magic bullets.
Not at all. It's really important to understand these are just supportive measures. They are absolutely not a substitute for diagnosing and treating the actual underlying medical problem. They won't fix a tooth root abscess or cure pneumonia.
Got it. So try to tempt them first. What if they still just won't eat or can't?
Okay, if voluntary intake isn't happening, we have to step in more directly. If the horse still has a functional swallowing reflex and is cooperative enough, we can try assisted oral feeding. This usually involves mixing up palatable feeds into a slurry and gently syringing it into the side of their mouth, giving them time to swallow. If a horse is unwilling or unable to eat enough voluntarily for, say, more than 2 or 3 days, or if they need specific liquid meds or nutrients delivered reliably, then nasogastric tube feeding becomes necessary. We can pass a tube through the nose down into the stomach and administer commercial liquid diets or slurries made from soaked, complete pelleted feeds. But this needs care.
Risks involved.
Yes, you have to be careful to avoid accidentally putting feed into the lungs. That's aspiration pneumonia, which is very serious. And you need to avoid overloading the stomach, so it requires careful monitoring by a vet or experienced technician. Then the most intensive option is parenteral nutrition, which is basically IV feeding.
Directly into the vein.
Exactly. Total parenteral nutrition, TPN, provides all their calorie, protein, fat, vitamin, and mineral needs intravenously. Partial parenteral nutrition, PPN, provides some of it. This is reserved for the really severe cases, horses that are profoundly anorexic, or those whose gastrointestinal tract just isn't working properly, maybe due to severe inflammation like colitis, or if the gut motility is stopped, which we call ileus.
Sounds complex and expensive.
It is. It's very expensive, requires placing a special central venous catheter, needs absolutely strict sterile technique to prevent infection, and demands intensive monitoring of blood work, usually only done in referral hospitals in critical care situations. Alongside nutritional support, other care is crucial. Fluid and electrolyte management, often with IV fluids, is vital to correct dehydration, maintain balance, and support organ function. Anti-inflammatory and pain management is key, using NSAIDs like flunixin or phenylbutazone appropriately, or other painkillers if needed. And sometimes gastrointestinal support like prokinetics drugs like metoclopramide to help stimulate gut movement if there's stasis or ileus, plus maybe probiotics or prebiotics for gut health, and things like sucralfate to coat and protect ulcers.
So it's a really comprehensive approach, tackling the cause while supporting the whole horse. Okay, once a horse has potentially gone through all that, what's the general outlook? Does every horse bounce back okay?
Well, the prognosis. It's highly variable. It really depends heavily on several key things. First and foremost, the underlying cause. If it was something relatively simple and easily treatable, like straightforward dental points or an uncomplicated choke that resolved quickly, the prognosis is generally excellent. They bounce back well. However, the cause is a severe, chronic, or unfortunately untreatable condition like end-stage kidney or liver failure, advanced cancer, severe neurological damage like from botulism, then the prognosis becomes much more guarded, often poor.
Makes sense. What else influences it?
The duration and severity of the anorexia itself plays a big role. The longer a horse goes without eating properly, the more weight and muscle mass they lose, the more metabolic problems develop. All of that makes recovery harder and worsens the overall prognosis. Time is often critical.
So acting fast helps.
Definitely. And thirdly, the development of complications. Secondary problems can really derail recovery. Things like aspiration pneumonia developing after a choke, or laminitis kicking in due to systemic illness or stress, or hyperlipemia developing in susceptible breeds, or further organ damage. Complications significantly worsen the outlook. And finally, of course, the response to treatment. How well the horse responds to the therapies provided is a major factor. Prompt diagnosis and appropriate aggressive veterinary intervention generally lead to a much better outcome.
So listening to all this, the really big takeaway seems to be early detection is key, right? Being observant and getting help quickly seems paramount.
Absolutely. That's the crucial message. Early recognition by the owner and getting swift veterinary intervention for any horse showing anorexia or even significantly reduced food intake. It's critical. These signs are often, as we said, the horse's loudest way of signaling that something serious might be going on underneath, something that needs immediate professional attention. Don't wait too long hoping it'll just pass.
We've certainly covered a lot today, navigating the complex reasons why a horse might stop eating, looking at that whole veterinary detective process for diagnosis, and detailing the wide range of treatments and support. It's really clear now that this is far more profound than just, a horse being picky. It's a critical indicator, potentially an urgent one, of their overall health and well-being.
Yeah, I mean, considering how absolutely fundamental eating is for a horse's health, for their very survival as grazing animals, this deep dive really underscores that refusing food is rarely just finickiness. It's often their clearest, loudest signal that something fundamental is deeply wrong beneath the surface. So the next time you see a horse turn its nose up at a meal, maybe pause and think, what could really be happening?